Studying human anatomy can be hard. How different parts of the body come together and function as one may seem like a difficult thing to understand. But once you have a grasp of basic concepts, it is not that hard to understand. The same is the case with human anatomy. Anatomists have divided the human body into regions. The region of our discussion is the upper limb. So far, we have covered different topics in our upper limb series. You can check out the full video lecture here at sqadia.com. In this lecture, what we will be discussing in detail is the arm. The arm extends from the shoulder joint to the elbow joint. The skeleton of the arm is a solo bone, the humerus. The musculature of the arm is divided into the anterior and posterior compartments by intermuscular septa. The division of the muscles into compartments gives them individuality in their function. For example, the anterior compartment comprises flexor muscles that flex the arm, and the posterior compartment consists of extensor muscles that extend the arm. But how does this division into two compartments occurs? The arm is enclosed in a sheath of deep fascia. Two fascial intermuscular septa, one on the medial side and one on the lateral side, extend inward from this sheath and are attached to the medial and lateral supracondylar ridges of the humerus, respectively. In this way, the upper arm is divided into an anterior and a posterior ossifascial compartment, each having a set of muscles, nerves, and arteries. An interesting fact to know here before we move ahead is that the Latin term for the arm is brachium. So most of the structures in this region are named accordingly, like brachialis, coraca brachialis, and brachial artery. In the upcoming section, we will talk about the anterior and posterior compartments of the arm, where we will talk about the muscles, nerves, and arterial supply of the arm.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.